Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Ilana Gurevich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
All right, welcome back, everyone.
Hello.
We've got another wonderful episode today.
Another wonderful episode.
They're all wonderful.
Two people with personal experience.
Yep.
In the past. We are going to talk about GI issues in pregnancy. Which
Those
is
don't
a whole
happen at all.
No.
No one has any issues with constipation.
No.
reflux.
Nope.
Slow motility.
Easy peasy.
No issues at all.
Why does this happen? Should we start there?
Good,
Yeah.
good
I mean,
question.
I think as somebody who has been pregnant,
Yeah.
it took me by surprise
How bad it was.
how much your digestive system
Yeah.
changes.
Well, one, your organs are getting rearranged.
Word.
Yeah. I mean, where do they even go? I don't know. Been there. It's a mystery to me.
That's a really fair question.
Run
Yeah.
that real estate.
Yeah. And
Yeah.
then motility changes because of the hormones.
Progesterone
Or
slows
my
down
question
everything.
is, was it a motility change because of the hormones, or was it a motility change because this growing
Physical
parasite?
obstruction.
real estate. It's a real estate
Yeah, it was-
issue.
Yeah, as well.
And progesterone, as we put people on progesterone for menopause or whatever, it slows things down.
Yeah,
Okay,
Big
so
time.
what do we want to start at the top and work our way down?
sure.
Should we start with like the hyperemesis
Oh, yeah.
type of people? Like that's a pretty good beginning.
Also, morning sickness.
Also known as all day long. Morning sickness is a misnomer. It's not just in the
That is
morning.
Such a true statement.
And sometimes worse when we give people the B vitamins, right, in the prenatal.
Oh, yes. Yes. Those
Big
people.
time.
I did
That-
not have I did not vomit. Did you vomit?
I
Okay.
had
The worst.
it. I had it. I think for me, my digestive tube is just so small. So I see, people with longer torsos seem to do better in this run, again, with the real estate thing.
Huh.
Like, there's room
Yeah.
Right.
for things to disperse. But yeah, the morning sickness thing, starts early first or mid first trimester and then just usually goes out with a bang. So usually by the end for most folks, but it is rough at the end. So at week 10 to 12 can be brutal.
So let's where I usually start with if somebody comes in with morning sickness,
Yeah.
and this is my personal story because it just moved the needle so much for me,
Yeah.
is
Acupuncture.
acupuncture.
Yeah, that's where we would send people.
Yep.
I'm thinking we have studied the hell
Yeah.
out of drugs.
Yeah.
Not all drugs, but many drugs. So
Yep.
we know the risk with pregnancy. At least we know it for now until they change the designation, and then we don't know it anymore.
Yep.
Acupuncture, we've been doing it for what?
Yeah. There are a couple spots we can't do if you're pregnant.
Yep, thousands of years.
There are plenty that work. What do you find in terms of efficacy with it? Like, how long do they get relief from it, and how often does it work? Kind of.
Okay, so when my own personal story is, I was when I got pregnant with my first, I don't think I was ready to be pregnant, right? Like I think I was like, yeah, we're trying, but then I was like, no, I work, and
Here we are.
I'm not going to change my life. I'm going to work, and then I got pregnant, and then it just hit me like week 6, hit me like a ton of bricks. And then I went in to see one of my colleagues. Luckily, I was in a multidisciplinary clinic, and I went in to see one of my colleagues, and she did acupuncture, but she also put some tacks on me,
Right.
like some sticker tacks. And my morning sickness went away. And I was like, oh, I guess I'm miscarrying. You know what I mean? And
that powerful.
it was that powerful. Like I was back to normal. I just assumed I was miscarried. It was weird that I didn't start bleeding. I just
Yeah.
assumed I was miscarrying. And did totally gone, never miscarried. The baby was still viable.
Yep.
And at 15 weeks, the tack fell off.
Wow.
It stayed on that long.
It stayed on very long. And my nausea, like a wave.
Yeah, totally.
crashed right
That
back
happened
over
to
me.
I was at clinic one day and I like took my tack off in the middle because I don't know why it was like peeling off or something, and I had to run to the bathroom.
And so there's particular points you guys
Yes.
put these tacks
There's a
in,
very
right?
specific point for nausea, and if anyone's ever heard of CBANs,
Yeah.
that you can get for motion sickness.
SEABNDS.
Yep, for seasickness.
Yep.
They're using that acupuncture point. They're kind of stimulating that acupuncture
Okay.
point. And those, can be really helpful too. With my patients, maybe you do the same. I teach them where to find it, give them some of those stickers.
Yep.
And when they come in, I really, we work on it, for a bit.
Yeah.
But it's not the only point. When you're getting an acupuncture treatment, there's a lot more going on.
Yes.
For folks.
But yes, so that is where I'm likely to start with nausea.
Yeah.
Let's say
get in as often as you can.
Get in as often as you can. Use the stickers, use the tacks. It doesn't help all people.
No, right.
Like there are lots of people who with hyperemesis who doesn't touch.
Yep.
And it does help a fair amount of people if you have
people.
access.
Yep.
We also know people don't all have access.
Yeah.
So acupuncture is where I usually start.
Yeah.
Next, ginger.
Right.
Yeah.
Ginger tea, any form of ginger.
You just gotta
your concoction.
Walk the line with heartburn.
Yes.
Right.
That can also flare in ginger to make that worse.
Sure.
But there are combo products that have a little bit of peppermint, lemon balm you can do. B6
Yes.
has
Right. We used to
data
give people
behind it.
B6.
I don't find it to be that helpful.
B6 and Unisom is the other one that a lot of people.
Plegis is
Yeah.
the drug name of it.
It's hit or miss.
No.
It's worth a try, but it's hit or miss
Unisom works.
for your nausea.
Doxalamine succinate works for nausea for people. It's a sleep medication. It makes you fall asleep.
Yeah.
So you can like do a quarter of a pill, quarter of a tablet or something. And kind of, some people that affect wanes if you keep taking a quarter, but some people it doesn't. And some people a quarter doesn't kick it, So that's hard. But have you seen the B6 help?
So I don't want to move away from ginger yet.
Okay.
So one of the things I want to talk about is the different ways of taking ginger.
Yes.
Because I don't think that all ways are equal.
Ginger ale.
So ginger ale is one way. A ginger chew is another.
Suck on it if you
Ginger
have to.
tea.
Those two are pretty sugary.
Yep.
Yeah.
You know what I mean?
Which can work for pregnancy.
but they're not super high in 6-gingerol.
Right.
And that it's the active constituent of the 6-gingerol that we think is having the effect on the nausea.
Are you going to do your free concoction thing?
Yeah, so I would like to talk about it. Yeah, again.
Man.
So
You got that down when you were pregnant?
dude, I was so desperate. It felt good to me. Ginger felt good to me.
Yeah.
So what I do is I will take I always have ginger in my freezer.
Yeah.
Like I keep it in the freezer and then when I need it, do people know about this? So if you put it in the freezer, when you need it, you can microplane it. And so then you always have basically the equivalent of fresh ginger whenever you want.
Zest it. Yep.
Yeah, zest it, right.
Yep.
So I will take a piece of ginger, fresh is best, better than frozen, to be honest. And then I'll chop it into like little matchsticks-ish, and I'll put it in a pot of water, put a lid on it, and boil it for like 30 minutes on an aggressive boil.
Spicy brew.
It is a spicy brew. For me, the minute I took it, it like settled my stomach.
Yeah. You can put a little peppermint in it if you want.
And so that's it. So ginger, I think can help some people, but it causes worse heartburn for others.
Yep.
Peppermint can help some people,
Yep.
but it causes worse
My
heartburn.
caution with pregnancy nausea is you don't want to just rely on ginger or peppermint, because then you're going to start to associate the nausea. Because if you're in it for months, you're going to start to associate nausea with the taste of ginger. So you
could probably get that desensitized at some point with some neurotherapy.
Yeah. Or some EMDR.
Some
I mean, I definitely agree. People will stop ever eating or drinking it.
I started associating my house with the nausea. I hit a point where I was like, we got to get out on the weekend.
Yeah.
Like
wow.
Yeah.
I mean, you can desensitize that. There's lots of programs.
Tapping?
Not work that hard.
Brain retraining programs that can be done.
It's a commitment to brain retrain for ginger and peppermint.
And for postpartum, like
right.
True. You probably don't have time.
Yeah.
Okay, so ginger. Okay, so then that do you use lemon balm? I don't use lemon balm very much.
There's a formulation that has it's very commonly used for morning sickness that has ginger, lemon balm, B6, and a couple other things in it. I can't remember. And it's a big pill, but that one can help, especially if you're trying to avoid the taste of anything.
Right.
Which can be
a
big
that's a
factor.
good idea.
And that I do see helpful.
Protein.
So food
Protein
in general, because blood sugar dysregulation is going to make you so nauseous. So that's one of my lectures I have with people is you just transition from a human being into a grazing cow.
Yes.
I need you to eat every 2 hours. Set an alarm if you have to. Just shove something in your mouth because it's so much worse.
Yes.
if you get hungry.
Blood sugar regulation is such a big component of that hyperemesis.
And do we think it's worse in the, sorry, Rebecca, do we think it's worse in the first trimester because of the abrupt hormone changes?
We don't really know. There are a lot of theories. I see a bit of a correlation with people who just produce a lot of progesterone, which is good. That helps keep the pregnancy. But again, progesterone.
Oh, right, with the motility. Yeah.
So, and then bodies are just different, but that's not helping anyone.
Right.
And then that's where what some people say is you get used to the progesterone. Your body kind of desensitizes
like kind of
to
calms
it,
down
but
a
in the
little
beginning,
bit.
it's like
whoa,
more than
Yeah.
most people are used to.
Okay.
And so the other thing is, like, for me, at least, what I tell all my patients is, okay, you're in the first trimester. We lovingly call this the bread and cheese trimester.
I know.
The only thing that's going to be appealing to you is basically bread and cheese. Just go with it. Don't judge.
That's
it just
how I
is.
feel every night after work.
I think that's caused that different underlying cause.
Every night's a bread and cheese night.
So what I will tell them is hide, like, what really helped me was making these little paleo muffins that were like 6 eggs, almond flour,
Make them sweet,
a ton of
get the
protein and sweet. Like, and I just had them baked. And I remember one day I was so nauseous early in my pregnancy. So I literally made them and just had them on my side table.
Yeah.
We were on this trip and all of a sudden I see my husband eating them. And I was like, I'm going to kill you.
That's right. Yes, man. When people steal your food when you're pregnant, murderous rage.
Again, I feel like
I'm growing a human.
Yeah, lay off my snacks.
I have a separate shelf in my refrigerator normally. So
Now your husband can't touch?
Yeah. You guys don't have that?
No, most of the kitchen is mine. Let's be honest.
Yeah. I will just judge my husband for eating.
I'm just going to throw out there before I forget that book that I really like.
Oh, yes.
I used to send my friends when they were pregnant, the whole pregnancy handbook by, I think it's Dr. Joel Evans. I went to a conference that he was speaking at in like 2003. It's a really good book and it goes through the safety of, I think OBGYN, and goes through the safety of different things like ginger and such if you're curious about.
What is it called?
I believe it's the whole pregnancy handbook.
Because there's also books that I tell my patients they cannot read.
Oh, okay.
Like what to expect when you're expecting is basically just, this is how you mess up your baby this week. This is how you mess up your baby. Yeah.
Some things are so shameful.
It was written at a different time.
For sure. And for a lot of us, like your body is going to tell you stuff. And the more we outsource that, like bodies are different. What worked for you isn't going to work for someone else. And that's okay. But like there's some basics here that you have to eat more than you used to. Your metabolism's crazy.
Yeah.
You have to drink more water than you used to.
Yes. You have to give yourself rest when you need rest.
Did you do that?
I think I need less rest than most people.
Right.
But yes, if I had to call it, I called it.
I think the sleeping thing, I think there's a big correlation with nausea. So,
if
and I see
sleep.
it a lot, for if you already have like a toddler at home or like 5 kids already at home and there's no way you're getting the sleep you need. I see nausea get worse.
Yeah, that makes perfect sense, actually.
If you have the resources to be able to bulk up on sleep a little bit, the nausea isn't as bad.
Yeah, that makes perfect sense.
Of course it makes sense, but like, who can really do, a lot of people can't do that.
Yeah.
So if you can sleep, of course, for all reasons, but.
Okay, so that's nausea. Anything we want to say about that system?
I do see homeopathics.
Oh, yeah. I do too, actually.
For this, and that's not like a big part of my practice, but for kids and for pregnant people,
I agree, and it's completely safe.
Yep, on the market for that one. So, and then water and electrolytes, you can't mess around.
Yeah.
I would also say the nausea brings us to the next big thing, which would be constipation. I know we're kind of skipping some.
You're jumping down.
Let's. Okay.
But being constipated is going to worsen your nausea.
Sure.
Oh,
it's true.
Get your bowels out.
Okay, so we'll talk about that and the bottom.
Yeah.
But let's go through reflux part of the cycle right now.
That's the next stage.
Yeah, that sucks. Reflux sucks.
Yeah.
It's a thing that happens, especially as you lose architectural space.
So I see it flare first trimester with probably that progesterone rise and everything kind of hits and everything's going the wrong way anyway. And then yes, when you run out of space, forget it. Baby's kicking on your stomach.
Yeah.
What's your favorite?
I start with papaya enzymes.
I start with papaya enzymes too. They work so well. And they're so cheap.
In that population, they don't work for anyone else.
No, I agree. I absolutely agree. I absolutely agree.
And I have them chew like 4 with every.
Well, first of all, they're also candy. Like they're basically candy. Yeah. And it's like $8 for like 200 of them. Yeah. It's like so cheap. I buy like crap brand.
One caution though, there's a good brand of supplements that I like out there. They put peppermint in with it, and that is disgusting. It is papaya and peppermint
Yeah, it
Disgusting.
should not happen.
Make sure it doesn't have peppermint in it.
So
So
is papaya
PSA.
a known?
Mhm.
I know we use it for digestion, but I didn't know
Yeah.
it was a reflux remedy
It's
in
an
general.
enzyme. It's an
Right.
actual
and it's
enzyme. Yeah,
completely safe in pregnancy.
Yeah.
Yeah.
Okay.
And so papaya enzymes absolutely is where I'm going to start.
Yeah. It works.
It works
It's
really,
like
really well. Yeah.
70% of the time.
Yeah. Yeah. Yeah.
Yeah.
Yeah.
What else?
When I'm talking about reflux, luckily, I have the luxury of living in Portland and I
Yeah.
can refer to Dr. Sand.
Yeah.
Maya.
Yep.
Like Maya just
definitely a
literally
win.
tracks things. So you want to
Yeah.
talk about it?
Yeah. So for my pregnant folks, when we sit them, obviously when you're super pregnant, you can't lie all the way back. Most people can't. So we kind of prop them up and then we'll work on pulling the stomach down, loosening the diaphragm, kind of coaxing baby gently to move down if their feet are kicking, just creating space for the stomach
Mhm.
to do its thing. And that provides, I would say it's similar relief to acupuncture. I see help like maybe 2 to 4 days of relief.
Yeah.
Maybe 1 to 4. Some people don't get that much traction. Same with this.
Yep.
So, and people can come in as often as they want to spend time with
Yeah.
me and sort of get things moving. And then also, we can kind of help to reposition the baby to some degree and just create space.
And that's the other thing that I'll often talk about is repositioning the baby.
Yeah.
Like, the conversation that I have with patients is, especially as you're like 32 weeks forward with pregnancy, your abdomen is like this big hammock.
Yeah.
And your baby wants to have its backside on that big hammock.
Yeah.
But if you're leaning back, if
I
you're
know.
lounging, if you're slouching, if you're in a desk job like this all day,
Yep.
that baby is going to feel very crowded and then it's going to turn.
Yep.
Its head can come up, it's going to turn up. It's not a good position. Having awareness of posture is super important. My instruction to all of my pregnant patients
I always
is
have you in my ear. with
starting
this.
at 32 weeks,
Yeah.
I need at least 10 minutes of you doing hands and knees.
Yeah.
Like, I don't need you cat cowing, but I need you in that position just so baby can get that hammock.
You can watch TV.
I would watch like
chat
Jimmy
with your
Kimmel or whatever.
family.
Yeah. Like it was
Yeah.
like my time and it was just, and it's just, you need to become borderline obsessed with your posture
Yeah.
because the last thing you want is a baby that's posterior and having to deliver that baby. Back labor sucks.
Yes, it does.
Even with an epidural, it sucks.
And the baby likes the space.
Right.
It's going to relieve the organs, to be able to move around a little bit, relieve your diaphragm. So, yeah, that slouching position that's so comfortable
Yes.
when you're pregnant.
Don't do it.
You can't do it.
You can do it until 28 weeks. And then by
But
32
then
weeks,
people get
borderline
used to
obsessed.
it.
I
People
know.
get used to it.
I know.
So stand, move, wiggle. Like
Ball.
the same things always. Move
Yeah.
our abdomen.
Yes.
you know?
Yes.
But yeah, and it's funny how different babies carry differently. Like bodies carry differently, but then the babies, some of them just nestle up by
Yeah.
the stomach, even early on. And
Yeah.
I'm like, you got so much room down here. Like,
Yeah.
It's so weird.
But it just is attached to its little
Yeah.
spot.
And I also think with some kind of like physical medicine, whatever you're doing, the Maya or whatever, you're getting
Yeah.
more circulation to the area.
Yeah.
So things that might be stagnating just move. And I very often stomachs will thunk down. I'm sure you feel it too with people. And then we get this like gush of
Yeah.
gas moving through and just move the tube.
Just move the tube.
They
the
used to, when I was in residency, the senior OB doctors would still try to turn the baby. Do they still do that these days?
Some people do it.
Okay.
Yeah.
It was kind of high risk, I think.
I think that there are more tools, resources. Like there's this whole website called spinningbabies.com.
Oh, okay.
They have a bunch of exercises. Doulas will do it.
Oh, okay. Good.
Yeah.
Yeah. Yeah. And they'll
Yeah.
sometimes, I've had patients who said in hospitals, they'll try to do it too.
Yeah.
It's super duper painful. They'll usually
Right.
give fentanyl.
Yeah.
Okay.
Which also, do you want the baby having fentanyl?
Yeah.
Okay. So that's the stomach, esophagus area.
Probiotics.
Oh,
too.
yes.
So probiotics are safe.
Yes.
If it's just probiotics. Enzymes are actually safe too.
Yes.
But
Papaya enzymes.
I avoid the things with the ox bile and the betaine HCl and all of that. Some people are comfortable giving that. I'm less so. But
And you're saying even the lipase, amylase, protease is completely safe.
Veggie ones.
Yeah.
I just don't know.
I mean, I guess I usually would assume those are safe,
I would
mainly
too.
because they're endogenous. Like we make them already.
I see them work any differently
Then the
population.
papaya enzymes.
If they were on them previously, but
I loved my papaya enzymes. They were like
Yeah.
dessert.
yeah.
They were really like dessert.
Yeah, and they were great.
Yeah.
They worked for a
Still
lot of
take
people.
No, because they don't work for anybody else
Yeah.
besides
That's
a
so
pregnant woman. It's a very interesting thing. They work magic in pregnancy, but for nobody else.
And then, back to the meal portioning.
Yes,
Don't
absolutely.
have a bunch of spicy tomato sauce
Yes.
before you go to bed. Prop your bed up, like use posture, use gravity on your side for these things. Like you're not going to be able to get away with the stuff that you got
Yeah.
away with before.
Yes.
And have smaller meals. Like don't have a big dinner, even though the rest
Yep.
of your family's doing it. Have something small, have another snack.
Some bread and cheese.
Have another snack.
Yeah.
Yeah.
Have a snack waiting for you in the middle of the night when you wake up from the nausea. Right.
Yeah.
Just be prepared. Like this, be prepared. Okay, bloating. Bloating is a thing. Bloating. So, I don't usually go after SIBO.
Yeah.
Like, I think the hormonal change is going to cause some of that distension.
Yeah.
I think the anatomical changes
You
are going
get
to cause.
so gassy.
Yep. It's really interesting. It's weird. And belchy.
Yeah. Where does that gas
Yeah.
even come from? I don't know. It's wild.
So I will rely on a lot of the tools that I'm relying for the nausea, like for anything to move the GI. I'm relying on the ginger. I'm relying on the peppermint. I'm relying on acupuncture.
Get people walking.
Exercise. There's a little bit of fear mongering around pregnancy where we in this country, we have basically said pregnancy is a medical condition, but really pregnancy is like how our human race has survived.
Yep.
And there are countries that have very different stances on pregnancy. If you were exercising before, continue to exercise. If you were moving your body before, continue to move your body.
Yeah. And if you weren't, walk. If you were moving your body, just walk. We were all meant to do that.
Yes.
Most of us, if you're able to.
Yeah.
Just walk.
Pregnancy, the bloating, the tool that I lean on the most outside of acupuncture is moving your torso.
Yeah. And prenatal yoga.
Yes, absolutely.
Everyone's farting in there.
Yes.
Sounds like a good time.
Yeah. But, it's your people.
Yeah.
You're welcomed with open arms. And everyone's running to the bathroom.
Yeah, but your filter in there.
Yeah, exactly. Lots of ventilation. It's like an airplane.
It's so funny. I actually couldn't tolerate prenatal yoga because I was like, oh, this is just where pregnant women come to complain. Because you have like the opening circle and then you had like 4 minutes of like stretching and then the closing circle. I was like, just give me regular yoga.
We need community.
Yeah.
We need community. Yeah.
So that's how I tolerate bloating.
Yeah.
That's why I help with bloating. Okay.
Mine can also help with that. And then I do think bloating brings us to the next topic.
Constipation.
Yeah.
Which is probably the biggest
topic.
So here, look, can we just recap very quickly? If the constipation becomes severe and you are wrestling out your poop every bowel movement, you are waiting to get a prolapse after pregnancy.
You can't. I tell everyone we have to protect your pelvic floor. If this is their second kid or third kid or whatever, like they know what they're in for. First timers though, I'm like, look, we really, what your pelvic floor is gonna be doing.
Yep.
We got to protect it every way possible. Just don't have gravity do anything worse to it.
Do they have people do strengthening of the pelvic floor beforehand?
We should.
Days? Okay.
I refer anyone who's interested to pelvic floor PT. Yeah. Just start getting that.
Will they do internal work?
Yeah.
Yeah.
Yeah. They'll even do rectal.
Oh, interesting. Mm-hmm. Yeah.
So preventing prolapse. No one escapes a lecture on a squatty potty.
Oh, yeah. Good call.
Because we're just going to relieve some of that pressure.
Give the lecture. What is it? How does it go?
It's
use
mandatory.
a squatty potty.
That's it.
It's mandatory.
You have to get a squatty potty. And then I tell people in advance, like, it's not going to make your poops easier necessarily. Some people it does.
Yeah.
But it doesn't fix constipation, or we probably wouldn't have this podcast. But it
or
does
be constipated.
I feel like a lot of toilets in America are too high.
They are.
Yeah.
I'm like, what is going on
We're
here?
also short, but
I requested a shorter toilet for
Did you?
Yeah, from my husband, but he said it's not ready to be replaced yet.
I mean, you have one of those high-end Japanese toilets.
It's just it's a bidet, but he could put it on a shorter toilet. But
you just need your knees.
It's been rejected for now. It's not the same. I prefer the lower toilet. But anyway, do what you got to do.
When I lived in China, the toilet in my house was a squatty potty.
Was a hole?
No. They're porcelain.
Huh.
And they have like little grooves. When you flush it, flushes the whole thing. It was brilliant. Yeah. It was great.
Nobody talks about the Chinese toilets, only the Japanese toilets.
Very different.
Totos.
Huh.
Yeah, it was great. I loved it.
So ergonomic position, very important.
Pelvic floor, so you don't weaken the pelvic floor.
Because if you're pushing a baby out, you're going to get some hemorrhoids.
Well, that will be our last condition of pregnancy that we'll talk about.
Okay, end of the tube.
Magnesium.
Magnesium citrate, totally
Magnesium citrate, magnesium oxide.
Yeah. But water, because your blood volume doubles in pregnancy. So you need water and electrolytes more than you think.
Yep.
And that is going to help your poop as well.
So magnesium citrate, magnesium oxide, I have patients increase their dose every 3 days.
Great.
So we start with 1 if you're not moving. We
Yeah.
go to 2 if every 3 to 4 days, because it can take that long sometimes.
Works better
If-
in empty stomach.
Works better on empty stomach, also has the side effect of helping you sleep.
Yep.
And if you hit diarrhea, don't stop. Because if you stop, you're going to go back where you were.
Totally.
Back up 1. I know you had a rough day because you've hit diarrhea,
Just dial it down.
but dial it down.
Yep.
Don't turn it off.
Yep.
And also there's this thing about like, okay, maybe I need, 4 one night and 3 the other, or 4 one night and 5 the
or
other.
more
Like,
when you're traveling, or more when you're stressed.
Yep.
or-
so, and then also fiber. I cannot say how much fiber can help.
I know. I've had a number of people who their midwife or OB told them not to eat as much fiber because they were bloated.
Oh.
Right. And I was like, absolutely not. We maybe want to pick and choose some fibers that are less bloaty.
Yes,
But you're going to be more constipated if you
for
don't
sure.
have
Yep.
fiber.
Yep.
And you're only eating like Cheerios and
Yep.
crackers.
Yep.
Not good. Not good.
And
So-
then fiber,
Fermented foods.
and probiotics. That's what probiotics was where I was going.
Yep. Fermented
Yeah.
foods.
For some people, they work really, really well in pregnancy.
Yep.
Yeah.
Yeah, it's a different balance. And I would say
Yeah, it's an
easier to
interesting
even tip if you know what you're doing right. But you can't pretend that you can eat and be how you were when you weren't pregnant. And that's a tall order. It stinks.
Yeah,
it's
yeah,
hard.
yeah,
Like
yeah.
your body is new. It has new cues and signals. But there are tools. We
I
just gotta
remember I
roll with it.
was like, I'm not pregnant. And then we went to this Alaska trip, and it was like a tight space. And I was like, why can't I fit in this space? And my husband's like, because you're pregnant.
Do you ever get stuck in a bathroom stall?
No.
God, that would be the worst in the airplane.
How did you get stuck?
I was too large and I couldn't.
Oh, you
turn.
couldn't
I had
navigate.
to like beep, beep, beep my way out of a bathroom.
It is
twice.
like the cognitive part of it is very
You have to get used to it. It
strange.
happens quickly. Sort of.
Yeah. And
Some
like,
weeks quicker than
at
others.
this, where we live now, we're starting to have babies in like our 30s, not in our teens or
Right.
20s.
Yeah.
Like we've been in these bodies for a long
Forever.
time.
And then the cues are all different.
Yeah.
Food aversions,
Oh.
tangentially related.
Very important.
Masks helped with that.
Huh.
And then I would put a cotton ball dabbed with like an orange essential oil in my mask.
Huh.
So going into grocery stores, because everything smells like
Right.
rotten meat and rotting fruit. In a grocery store.
Interesting.
Yep, that worked. Or doing PAPs,
Oh, yeah.
because you're just so sensitive to smells.
Yeah.
That was really helpful.
Wow.
I know. And I never
It
would've
did,
had
and
that
the
without
smell
mask.
didn't make you nauseous?
Orange helps. The scent of orange. They'll even do it on like maternity wards for folks that are just there for hyperemesis. They'll
Huh.
like diffuse essential oils. We have some studies on it. It's cool. Of orange.
Interesting. I
Yeah.
never would have thought of that.
Yeah. Orange, citrus, sour,
Peppermint.
peppermint. Yeah. I know. Yeah. Scents can
Okay.
really
Yeah,
make
and
or break. a
I mean,
situation,
it does
I'll
bring
say.
us right back to the hyperemesis and
Yeah.
the, yeah.
Yeah. But I will say, make sure you're pooping, number one.
Yes.
Because your tube's already slow. And if you're stalling it for another reason, like constipation, it's going to send those signals back to the rest of the
Yep.
tube to stall.
Yep.
So that's always my number one is like poop, even err on the side of looser if you have to,
Yep.
to get it out
I think that brings us to hemorrhoids, the very bottom of the tube.
at the end.
So if you are wrestling out your stool,
Yeah.
you are more likely to have hemorrhoids.
Yeah.
Just by the nature of pushing out a baby, you are likely to have hemorrhoids.
Yeah.
In Oregon, we have this amazing technique called the Kesey
Yes.
technique,
Yep.
which is using a low volt galvanic current to like, I'm going to say zap, but it really like taught in
It cauterizes.
does it cauterize?
I think so.
I was under the impression that it just like reinvigorates
Helps the
the elasticity. That's what I thought it was
I
doing.
don't know much about it.
It's relatively painless.
It's
It's
so-
safe in pregnancy.
Yes. And my recommendation, honestly, is get them treated before you have the baby.
Totally. And
Because
then
you
again
can-
after if you need to.
Yes, but an ounce of prevention is worth a pound of cure.
For sure.
It's a non-surgical technique that's localized here. I don't know if they have it in the rest of the
Yeah,
country
we're lucky.
or the rest of the world. It's amazing. But that works so well for hemorrhoids.
Yeah.
Let's say you don't have access. There are some really good herbal suppositories that are
Yes.
available
Yep.
using witch hazel, St. John's wort, butcher's broom, cocoa butter,
Yep. Yeah, you can do sitz baths.
sitz baths.
You can't let your body temperature go up too high, but you could do like a neutral one with calendula or whatever else in it to kind of astringe and soothe.
Yep.
If you want to do that. Those are nice postpartum too, so you might as well just invest.
Preparation H.
Yep.
I mean, that works for some people. That's not my favorite.
Yeah.
Sometimes if it's really, really bad, you can use some steroid suppositories, and there are surgical treatments for the hemorrhoids, but they're like kind of barbaric because every time you have a bowel movement, you're irritating that open
Give a
wound.
lot of scarring.
But that is the other possibility. Hemorrhoids are a big deal before you can try to prevent, but when you're pushing out a baby, it's just higher risk.
You're going to get hemorrhoids. If you're pushing a baby out, you're going to get hemorrhoids. And, you know, it's just anything you can do to prevent them from already being there, just go for it. The first bowel movement after childbirth, that is no joke. And I spend a lot of time with my patients kind of counseling through. I want every resource in your medicine cabinet. If you have the wherewithal during childbirth to be doing some magnesium, doing some stool softeners, just get it in, because that is rough. Painful and rough.
Yeah, I don't remember that being a big deal for me.
Oh, it is.
And I pushed my first one for 6 hours.
Patients who say it's worse than the child.
Wow, really?
Yeah.
Okay.
So
I believe you.
Just don't mess with it. Everyone that's another lecture. You're going to have your magnesium citrate. You're going to have your suppositories. Just invest even if you don't need it.
Yeah.
You're going to sell some sort of kit?
I have a lot like,
I mean,
baby registry list,
yeah,
you know, my postpartum healing kit,
yeah,
you know, all the herbal, wonderful things that we can do. But yeah, that's one thing that you can prevent.
Yes.
We just don't educate people on how to do better.
Yeah. Yeah.
So save your floor.
Yeah.
If you can.
Anything else that we're missing? Any chronic?
I think they covered a lot of the tubes. So GI stuff is a thing.
Yeah. GI is the thing in pregnancy. Yeah. Or maybe that's just my perspective because all I do is GI things.
It can quickly become the thing. Yeah. Cool.
Okay. Thanks, guys.
Thank you. See you next time.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.